Are you having difficulty going downstairs after your knee replacement or after your knee surgery? A lot of my patients are having difficulty climbing steps, going up or down, but most especially going downstairs after their knee replacement or after the knee surgery. And this is because you're loading that leg at the same time you're bending it. So the knee doesn't like that, especially after the surgery. Hi, this is Reggie from Result Plus Physical Therapy. And in today's video, I'm going to show you how to train, how to practice to go down steps properly after your knee replacement or after your knee surgery. So make sure you watch to the end so you'll know what steps to take, how to be able to do that, how to practice so that you'll be able to go downstairs normally after the knee replacement. Now, before you try this, I want to make sure that we hit a few key points there. One is you have to make sure that your leg is strong enough to be able to do this activity, because going up and down the steps, that's a more advanced activity. Your leg has to have enough strength to carry your weight before you can do that safely. Of course, when you're going to practice this, you can hold on to handrails, or if you don't have it available, you can hold on back of the chair or something, right? Or have somebody to assist you. But the most important is you still will have to have enough strength on that leg, because if not, your leg is gonna buckle and you're gonna fall down. So we want to avoid that. There are other videos I created on how to actually strengthen that leg using different exercises. You can squats or you can weights. There are different exercises on how you can strengthen that leg. Key muscles to strengthen there will be the quads and the glutes. So the quads is make sure, because that's the one that's going to prevent your knee from actually buckling when you're putting weight on it and when you're going down. So make sure you have enough strength on that quads. The other thing you have to consider is your balance. You have to make sure that you have good balance, that you can balance on one leg to be able to do this exercise safely. I created other videos that will show you how to improve your balance. So you can watch them, you can refer to them before you actually go into trying this exercise. Of course, when you do this exercise, you have to have some handrails around, or you can use the back of a chair if there are no handrails, or make sure you have someone next to you so that they can help you in case you lose your balance. Now that we got that out of the way, let's get right into it. So I have an 8-inch step here. So 8 inches is the standard height of a normal step. There are steps that are steeper. There are steps that are shallower. I pick 8 inches because that's a standard height. So you're going to practice on a step like this first before you actually hit the stairs, so that when you go climb the stairs already, you know that you'll be safe enough. You know that you will be able to do it. I'm going to show you how to practice going downstairs properly. First, I'm going to show you how most of my patients do it, or if you had your knee replacement, this might be how you're actually doing it. So most of the, let's pretend my left leg is the one that had the surgery. So going downstairs, most people, they do this. They just hop off straight. And that's not safe, because if you do that too fast, you're going downstairs, you lose your balance or you miss that step, you will actually fall down. You'll go tumbling down the stairs. Most of the patients, they do this. And the reason why is because, one, they don't feel comfortable putting weight on that leg. And also, they want to take the weight off of it as quick as possible. And then also, is they don't want to put the weight on it and at the same time bend it. So that's why they do a shortcut. Is they put the weight on it because they need to take the right foot off the step, and then they just quickly jump down. You see, the knee doesn't even bend too much when you do that. That's why they don't want to sit back or sit into it, because they don't want to put that weight and then bend it. So they do this. That's not the right way to do it. That's not a safe way to do it. This is how you would want to practice so you can go down the steps properly. Now, put your weight on this side, and then what you want to do is, as you put your other foot down, as you put your other foot into the next step, you want to sit into it. Sit into that left leg, or into that leg that had the surgery. So you want to be able to do this, right? So you want to bend that knee and bend that hip also. Stick your butt out. So you want to be able to do that. Doing it this way, it will recruit your quads, and it will also recruit your glutes. You'll use two big muscles that will help support your weight, that will make it more comfortable and make it easier for you to go down the stairs to descend properly, because those muscles will be contracting in a lengthening movement or an eccentric contraction, especially the quads there, right? It's going to carry a lot of your weight. So that's, you want to be able to practice that movement. Okay, so again, you're going to put the weight there, put this down, sit into it, stick the butt out, and make sure you get comfortable bending this knee. Now, this is similar, if you actually take a close look at it, this is very similar to doing a one-leg squat. So that's why getting that strength on that leg is very important. Usually, before you go to this step, I have my patients do squats first, or even one-leg squats before they actually do this. But at least be able to do squats properly with even weight on both feet before I would have them attempt to do this, so that we are sure that it will be safe for you to practice this exercise. Once you know how to do this properly, or you are able to do this properly, you just have to keep repeating it. Get used to the mechanics, get the leg stronger, get your balance better. That way you'll be able to string them together one after the other. Because going down on the other leg is not going to be a problem for you, because that is the healthier leg, or that's the stronger leg. Now doing it with this leg, this will help you be able to reciprocate that, which I'm going to show you how to do it once we string it together. All right, now let's put your practice into practical application. So let's put it into work. Earlier, we were practicing on the step. We're doing one step at a time, right? And also making sure that you're comfortable putting weight on that leg, and you have good balance, you're comfortable putting that weight and bending that knee. So now we're going to string them together. We're going to do it reciprocal, which is the normal way to go down the stairs. I know in rehab, when you're recovering from the knee surgery or knee replacement, therapists will tell you up with the good, down with the bad. But that's not the normal way of doing it. That's not the normal way of going up and down the stairs, especially going down the stairs. And plus, that is a very slow way of going down the stairs. So this way is you're going to do it normally. All right, so let's go right into it now. So let's put this in action. So what we're going to do is you want to lean into that leg, and then as you put weight on that leg, you want to stick your butt out, bend your hips, and bend your knees. Make sure you hold on to the handrail just for support, for safety, so especially if it's the first time doing this. So put the weight on that leg, go up one step further here, put the weight on that leg, and then start putting your right foot to the next step. And then you're going to stick your butt out. So again, like earlier, you're going to stick your butt out, bend your hip, bend your knee, going down to the next step. So let's do this. Hold on to the handrail and bend your hip and knee, stick the butt out, put the other foot down. And then with this step, you won't have difficulty. This is your healthier leg, or this is your stronger leg. Then you should not have problems putting your weight, and you'll be able to step down easily. And then you repeat the same process again. So let me just go a couple steps up here so you see it more. So from here, you're going to put your weight on the left leg, which is the leg that I had my surgery, as we said earlier. And then your hip and knee, stick the butt out. And from this, you go step, and then again, step, and then again. Right? So just string them together, one after the other. Do it slowly at first, and then once you get the hang of it, you can go a little faster. When you did it properly earlier with the step, you're building the strength on that quads, on those glutes. You'll be able to, you have been practicing on your balance, and then the coordination. And then if you are doing it 20, 30 repetitions, doing it 1 or 2 flights to practice that, I recommend doing it a couple of times a day. You should build up to that endurance also. So going up a couple of flights of stairs should not be a big challenge for you anymore. All right? Now that you know how to do that properly, go and practice. You want to make sure that you get your strength, your coordination, your balance, and your endurance, so that you'll be able to do that safely. Let's get your life back, because this going down the steps is an essential part of our daily lives. Thank you so much for spending the time. Thank you for watching this video. I hope this is helpful to you. Please share this with someone you love so that it can help them get their normal life back. And don't forget to hit that subscribe button and turn on your notification so that you can get alerted once we release the videos, because we release new videos every week. Again, thank you very much and I appreciate you.